Not every pregnancy develops in their right position. That's what we call ectopic pregnancy. Ectopic meaning out of place, meaning the pregnancy is not growing in its right position. The right position for baby growth is in the uterus. And what happens if the child is not growing in the uterus? We talk of ectopic pregnancy. Normally, when an egg is fertilized after sexual intercourse, this egg has to implant at the level of the uterus. And if this egg is implanted out of the uterus, for example, at the level of the fallopian tube or at the level of the abdomen, the cervix or the ovaries, that will lead to ectopic pregnancy. The most common type of ectopic pregnancy we have is the one developing at the level of the fallopian tube. That is the most common type of ectopic pregnancy. In this video, I'm going to talk about ectopic pregnancy, the one that develops at the level of the fallopian tube, which is the most common type of ectopic pregnancy. I'm going to talk about the signs and symptoms of ectopic pregnancy, why this is a serious medical condition, and what you have to do in case you are suffering from ectopic pregnancy or you see somebody having ectopic pregnancy. So when the fertilized egg starts developing at the level of the fallopian tube, which is not the uterus, and looking at the fact that the fallopian tube is much more smaller than the uterus, this child is not going to be able to be viable at the level of the fallopian tube. This baby is not going to grow at the level of the fallopian tube up to maturity. That will cause rupture of the fallopian tube, which will cause internal bleeding, which is not good for the pregnant woman. The signs and symptoms of ectopic pregnancy: we have the normal signs and symptoms of a normal pregnancy, and adding to it, we have vaginal bleeding, we have pelvic pain, we have nausea and vomiting, we have fainting due to the loss of blood. We can also have shoulder pain due to the irradiation caused by the internal bleeding. The risk factors for ectopic pregnancy: we have somebody that has one half ectopic pregnancy has a higher probability of having ectopic pregnancy again. There's also what we call pelvic inflammatory disease that can also cause ectopic pregnancy. Other factors that can also cause this ectopic pregnancy: we have smoking, somebody undergoing fertility treatment, or somebody that has one half a surgery at the level of the fallopian tube. That can increase the risk of that person having ectopic pregnancy. So how can this ectopic pregnancy be diagnosed? Adding to the signs and symptoms, their pregnancy tests have to be positive, and the doctor has to do what we call ultrasound to localize the position of the baby to see if the baby is not found at the level of the uterus before confirming that this person is suffering from ectopic pregnancy. Now, what is the treatment for ectopic pregnancy? We have medication and we have surgery. If you have somebody suffering from ectopic pregnancy, rush that person to the hospital as soon as possible, because as I said earlier on, ectopic pregnancy, there is what we call internal